You're watching the Isaiah Factor Uncensored.
And welcome back to the second half of the show tonight. Surgeons could be on the brink of a new medical milestone. Two pig organs, have been successfully transferred to brain-dead patients. Now, a 20-year-old, but first a 28-year-old college student suffers a horrible accident in this medical segment. She is now in the ICU, paralyzed after visiting a chiropractor. We have both now.
Obviously, we wanted to explore that issue with you. We brought you into this. So tell us exactly what happened after you did the research, after we asked you to look into this.
Sure, Isaiah. So this is a young female who was having neck pain, ended up going to a chiropractor where she received adjustments, and she had a disorder that made her a little bit more vulnerable. Her ligaments were not as strong as other folks, and it ended up injuring and damaging some of her nerves, and it resulted in paralysis and weakness in her arms and legs. I'm hopeful that it may be temporary. It may have caused inflammation in that area, and hopefully if the inflammation goes down and she's on appropriate medications, that paralysis may improve. However, this is a very serious issue that needs to be discussed. Isaiah, in the medical community, chiropractors do have a place and time for where they're necessary, and that's very appropriate in some cases. And that's why it's so important to go see a medical physician first, a medical provider first, before you go to a chiropractor, to make sure that you may not have some of these illnesses, some of these disorders that may make your ligaments not as strong as others. Furthermore, it's very appropriate to do further imaging studies such as X-rays, MRIs, and CTs to further evaluate the extent of damage before you start going and doing adjustments and popping necks and backs and that sort of stuff.
And I just want to make a point that, like you said, chiropractors do have a place in the medical field, and many people swear by them. However, for those who may have different issues, you're suggesting they go to a medical doctor first and then let them guide you to a chiropractor, or how does that work?
That's correct, Isaiah. You want to determine the etiology of what's causing the problem that's on hand. I often describe it as a driver and a passenger scenario, right? You want to figure out who the driver is, who's behind this problem, before you go treating the passenger or what may be the muscle spasms that you're dealing. You want to figure out why you're having those muscle spasms. A lot of times it's related to nerves that may be problematic. So if you have disc bulges in your neck or lower back, those can cause muscle spasms. And so it's very important to do a workup before just going straight into a chiropractor and having them manipulate your neck or back or other organs and body parts.
And before we lose you tonight, we wanted to bring up another issue that may be further down the road when it comes to medicine, healthcare, and science included, where they're now trying to put a pig's heart into a human. Now, we know that ended disastrous the first time when that was done, but now where are we where a pig's heart could be used in a human?
Yeah, so Isaiah, there were two patients that at New York University that were unfortunately young, and they had brain dead. They had a motor vehicle accident, and they were resulted in brain dead. However, they still had the organs that they could, some of the organs that they could still use. And so what happened is that these physicians, these researchers went in and replaced the patient's heart with a pig heart. And by doing that, they were able to get that up and running where the heart was working. Again, this just happened a couple of days ago. There's not enough research to see how far along this will get. The last time this was done, the patient survived about almost 2 months, and after that passed away. And so they're hoping that there's a lot of research that can be done with this. They're looking at different forms of hearts that they can try. The reason why they chose the pigs is because they have some anti-rejection genes that may help, and they may be better off with implanting those versus other animals that don't have these genes.
Well, we'll just have to wait and see if this actually works. Dr. Danish Ali, Arch Point Pain Institute, thank you for joining us here on The Factor Uncensored tonight.